adlaw karon nga Thursday, mga kasibya, live na bata sa atong FB page, sa atong YouTube channel. We're live na ta sa FB. Ato lang YouTube, murag wa pa siguro karong mga orasa. Kumusta nyo kabuntagon? Init nga kabuntagon sa adlaw nga Thursday. It's Feb 25, 2021. Karong adlaw mao ang pagsugod o pagtapos inunta no sa kining EDSA People Power Revolution mga kasibya no. Karong adlaw maoy paglayas, matawag na to pagpahawa, pagpalagpot sa katawhan ni atong 1986 sa diktadura nga Marcos sa mga kasibya. So bani ko ninyo hangtod ta sa alas 10 pero karong buntaga basi mo over tani no kay do na tay pabati ninyo karong taon mga kasibya nga forum no. Actually kuani kining matawag ni nato nga forum mga kasibya nga di naaron ang mga opisyal nato sa gobyerno no, lokal nga mga opisyal nato mga kasibya nga mutuki no kalabot gihapon sa mga lakang kalabot sa COVID-19 mga kasibya no, mga pagpangandam gihapon kalabot na sa bakuna mga kasibya mo na atong ipabati ninyo nga forum kana kung nakasugod na ni karong mga orasa no ang maong forum mga kasibya no ang maong forum tambungan ini no nila ni naa sila sa kuan magdungan sila si Mayor Edgar Labilla ug si Vice Mayor Mike Rama o niya naasad si Mayor Samsam Gulyas nga karon mo'y nipahibaw karon lang buntag na balik na siya sa trabaho no. Officially karon siya mobalik sa iyang trabaho kinaayo naman siya sa COVID mga kasibya pero holiday maron so why makita nga Mayor Gulyas diha sa Talisay City Hall. Naasad si retired General Miltiades Feliciano no ang deputy implementer sa COVID-19 dinis Kabisayan si Dr. Tambago kung sayo ni Dr. Tambago asawa ni si Nonong Tambago sa Virginia Farms no sa the pork shop unya ang kanhi presidente sa Cebu Chamber of Commerce and Industry na si Virgilio Espilita unya ang kasamtangang presidente si Felix Tagyam ang kasamtangang presidente ni sa Cebu Chamber of Commerce and Industry mga kasibya. Naasa diri sa religious sector si Father Orindain mga kasibya. Unya ang laing official na to, lokal nga official nga naa ning mao nga virtual forum mga kasibya si Cebu Governor Gwendolyn Garcia no. Cebu State of Health, how to take the crisis now. Unya unsay atong mapaabot mga kasibya sa kining maong pagtubag sa mga lokal nga kagamhanan sa COVID-19 ilabi na sa aspeto sa pagpamakuna mga kasibya no. So yan atong tan-aw ang maong link nila karong mga higayuna no kung naa na ba ang maong tiningkuan mao nga forum karong mga orasa kung nakasugod na ba kadiyot kayo nakita diri ang kanhi paglaing kanhi presidente sa CCCI si Mr. John Montuerto murag si Montuerto mao ikuan na nida ang nagpasiugda actually ani ang Cebu Citizens Initiative no living on with COVID-19 mga kasibya no ato isuyan og pabati karong mga orasa mo kwanta mo share screen ta ni mga kasibya although ako paninggi paminaw diri sa background ha kung kuan unsay matawag nato nga si Jun Monterto ang kanhi presidente Cebu Chamber mao'y kuan na ni mao'y modumaan ni maong forum siguro mga kasibya no mga kasibya karong mga higayuna no. Si Ma'am Jenjen Opad, tanan diehard followers SIbyaTV, init ang kay diri sa konsolasyon. Mura kunog mamaak ang kainit. Good morning sad ni Gerald mainit. Oh. Good morning sad ni Jay Nomiran, ni Angel Transporte, ni Wilson Boris Herrera, ni Mills Castro, ni Cristita Saraong, ni Sana Molina, ni Hana Bungkaras, ni Maria Mercinita Subing-Subing, ni Filipinas Maglasang, ni Maria Teresa Agbo, karong mga orasa. Ato na ning paminahon siguro no kinagsugod na gid ang forum makasibya no. Si retired Lieutenant General Melquiades Feliciano mao karoy nagtabi karong mga orasa no. Kadiyo kaya ato sa ning i-share screen mga kasibya no. Facebook, okay. Now na to mao ba ni? Murag mao. Kaya to sa ni ako sa ni ikuan ha. Okay. Mao na ni aton paminahon ha. Si General Melquiades Feliciano mo'y una karon ni good morning diha ni Ma'am Jennifer Magana diha sa Texas karong mga orasa may buntag niyo diha si Ma'am Angie Angga, si Nerly Piocnasia, si uban nato nga mga listeners karong mga higayuna atong paminahon na ni minahon na to ha ang maong forum karong mga orasa.
Okay, as to the EOC, by the way, I would like to inform everyone that we restructured the EOC. Basically, this increase in, if I may say personally, this increase in prices are still the effect of the holiday activities, the outings, the parties during Christmas and New Year seasons. And at that time, actually, of course, everyone knows that the situation then was stable. So the Emergency Operations Center adjusted to a meaner and leaner organization or structure. However, there is an increase in cases. Sad to say, the Emergency Operations Center was not able to adjust accordingly. So, you know, COVID, if it's not addressed appropriately, it will expand exponentially. And this is now the effect still of that, that situation from the last week of December until now. But I would like to inform everyone that since last week, the Emergency Operations Center has been in its original form. It has been aggressive in the testing, contact tracing, although in isolation, it's still late because there are still backlogs. No? It means to say that there are still positive indexes who are at home. But it's now the focus of the discussion on a daily basis on how to enhance further the extraction activities of the Emergency Operations Center. Hopefully, by the end of the week, we can, no? If we can extract all these positive indexes from their households and also the daily cases, it will help in lowering the cases because we cannot avoid transmission within the respective household if there are positive indexes. That's one of the main efforts now that the EOC is looking into. Okay, and also as to our temporary treatment monitoring facilities, we have a safe number of beds. We increase the number. There are now 10 as to the, we called them before as the barangay isolation centers. These are the immediate places or facilities that we could, use to accommodate the positive cases. So as of now, there are 409 available beds in those temporary treatment monitoring facilities, and there is a 500 beds, or there are 500 beds reserved. So as far as TTMF, will be utilizing 2 more beds, the Hotel Pier 4 and Sampaguita Suite in Puente Osmeña, that can have additional beds for positive patients, in 100 probably this week. By Wednesday, probably 75 will be added, and 25 more by the end of the week. So these are the preparations that are looked into by the emergency operation centers, so that isolation of the positive indexes will not be disturbed. Okay. Now, as to the, opening up of schools, physical presence of students inside the classroom, I don't think at this stage we can have it, because there is really a high prevalence of cases in the different areas. And as of today, actually, a week ago, the unknown cases, when I say unknown cases, these are the index cases that are not controlled. They are coming from everywhere. These are the results of the testing of the laboratories, different molecular laboratories, testings of the different hospitals that have testing capacity, and the testings of the city health department. So as of last week, the unknown index cases is higher, but now I can say that the controlled cases is higher than the unknown cases. These controlled cases are the cases of the close contacts who are on quarantine. So meaning to say, if this is higher, it's a good trend. It's a healthy trend already. And we're hoping that, we will get the peak of all the cases, but more on the controlled cases. This is one way of assessing how the intervention programs could be effective. No, if you have more than controlled cases, or to cut the spread of COVID in those areas. Now, the situation now on an ECQ. then modified ECQ. Then it was lifted into GCQ. Now it's M, and to strike a balance between the livelihood and the health of the population. So right now, although Cebu City is having this number of cases, but Cebu City is still open to economic activities, and that is very important. And one main consideration is that as long as the healthcare capacity is safe, okay, that's why the focus now, personally, I see the main concern now is on the awareness. Okay, the Emergency Operation Center is in its form now, and it's functioning aggressively. Aggressive in testing, aggressive in contact tracing. There is a good contact tracing now. We're getting all the details and the data. We are following up the behavior of the COVID. And also, we're enhancing the isolation. And of course, treatment is there because the hospitals are ready. Okay, but the main concern now is because the economy is open, the COVID carriers are very mobile. That's why we are now focused on giving awareness to all, especially the business establishment, that they should be part in the effort of the AOC. The AOC can only do so much. I'm saying the AOC now is very aggressive and active, but the different sectors should be part of so that we can continuously maintain and open the economy. Okay, the transmissions that are now identified are specifically in areas. Of course, it's in the community, in the household, and in the different business establishments. That's why the business cluster of the EOC is focused on making the business establishment aware that as long as this business establishment can make their staff or their customers compliant with the basic of following the health protocols, we will avoid or we will contain the spread of COVID. This is now the focus of the Emergency Operation Center. It's the awareness of everyone to observe the basic minimum health protocols. We are engaging the different business establishments on making them aware again. Because I'm saying this again because I'm seeing, based on our discussion and personal observation, there are lots of breaches in protocols among these establishments. Okay, last week I was able to talk to the hotels organization that they should be part of this and be involved actively in implementing the basic minimum health protocols within their establishments, because there were noted parties in those hotels, and you can see this result on why of the high-end subdivisions are having lots of cases, because the of this are the ones bringing the virus inside their houses, because of these parties and other activities. So this is the focus now of the Emergency Operations Center. Now, as far as the small scale and levels of businesses, they also are having our focus there, like the Pongko. There are cases that are noted. If I remember last week, during our last huddle Thursday and Friday, there were 7 cases because of Pongko. They're eating together there and they are not wearing masks. They are crowding in those places. Last Friday, there were 14 cases. Of course, if there are cases, cases in those areas, these are the spreaders in the households and in the communities. That's why we are looking into all these possible places of transmission uh, through our daily analysis of the cases. We get this data from the interviews of the positive indexes. So we know what the AOC, where are the places of transmission. That's why we're reaching out. In fact, the AOC is scheduling engagement with the transport sector, because the transport sector now are not anymore observant. Like, for example, the taxis, they are not opening their windows to have ventilation inside these vehicles, including the buses. Yesterday, we were at Onjet because we were in Cebu. In Bohol, to help also Bohol open up its economy. While going back, there are no marshals or there are no inspection officers in those vessels that are implementing. In fact, the passengers are removing their face masks. So these are the things that are happening now, and of course, if we will not correct this, like I have said, the situation now is different from before. Before, we were able to lower the cases by having similar EOC now because of a stricter implementation of quarantine. But for now, cannot afford, or Cebu City cannot afford to make a higher quarantine level, even GCQ. It will have an effect on the economic aspect, no? But we really want to maintain it, but for all the establishments to be part of the effort, being compliant with the minimum health protocols. Actually, that's my main message in this conversation, no? In this meeting, is for everyone to be aware, again, to the minimum health protocols. Because I was with the positive patients 2 Saturdays ago. I had a meeting with a positive patient, and I was orienting him of the task that he should be doing. But after learning that he turned positive, I was not even worried, because we are both, wearing masks, and of course, maintaining the distances of at least 1 meter. And I was tested before going to Bohol, and it's negative. So it's the proper protocol that should be compliant to really avoid this transmission, and for Cebu City, through its emergency operations center, can lower the cases. This is now the goal of the emergency operations center. So that's all I can say for now, Sherwin, and I'm open to questions
Okay,
from anyone.
General, yes. Thank you very much for the updates that you have given us, General. And I believe I speak well on behalf of the public that we appreciate the efforts that the IATF EOC has been exerting to stem the transmission and to contain the situation. Now, General, although you have touched it in part, like whether we like it or not, our people will go out of their houses to work for a living naman gyud, no? And we see a lot of them now on the roads and the market. Gladly, a lot are already conscious about wearing masks and social distancing and other protocols. But sadly, there is still quite a number nga murag di pa gyud siya conscious, General. While our LGUs already know exactly what to do to help prevent the transmission, ang pangutana ani would be, how will our people, unsa may mabuhat nato to, so that the public would improve in their capability to protect themselves and the others? What more can we do, General? And ang among grupo, Cebu Citizens Initiative, have taken some initiatives already, but maybe we would ask from you unsay mabuhat nato sa private sector to complement what you are doing in government, General.
Well, actually, Sherwin, this is one way we are engaging. So at least you will know the actual situation on the ground, because the AOC will be able to know the real situation based on the interviews of the positive index cases on a daily basis. So if there are some concerns in this establishment or anywhere, the EOC will design a program on how to address it. The EOC always acts on the data driven. So every day, the EOC is having this data. That's why the one I shared to you are the actual data. But of course, there are still data that the EOC now is considering, because we are designing every day. We are coming up with programs for the information and education cluster, coming up with the right narratives to make everyone aware, because of in reference to this analysis of what is happening now, the Barangay Affairs Office is also coming up with programs on how to address these reasons why. So we call everyone's attention if we are having this data on our daily analysis, Sherwin.
General, kanimangong atong pagkatao ba kanang atong complacency bitaw, probably it's because of our upbringing nga nahanglan ta nga dunay mobadlong pa nato. Now there are just enough law enforcers, whether policemen or barangay tanods, that are out in the field helping out to stem the transmission. General, do you think that is possible para so that we will already have that consciousness of marshalling for each other to call the attention of people not following the protocols to stop this pandemic?
Yeah, that will be also idea, no? Because this is a shared responsibility by everyone. Yeah, so it's a concerted effort by each and everyone. Like just this morning, we are having our daily huddle, and actually I scheduled a meeting with the barangay captains, the station commanders, and other individuals to talk on this, also what you are mentioning. And of course, we have a scheme on how to, just like the suggestion of one of the barangay captains, that they will serve as eyes and ears in the community. Then if they will see some violations, they will call the police station, and the police station will respond. Something like that. And we are also talking of an activity that will involve the different organizations in the barangay, so that they could also be part of this effort. So these are the things that are now being discussed, and that's also a good idea of what you have mentioned. And probably you can also tackle that with the barangay captains, because everything that is possible to make everyone aware, to reach everyone, that's the direction that we are going to, because we know it's more on awareness and prevention right now. If I may, because we've been in Bacolod also, and Pagadian, and Bacolod and Pagadian emergency operation centers were established later than Cebu City. And of course, they did not adjust because they, do all these activities, And you see the cases now. The OC, it's at its usual form, and depends on the awareness of this effort. Because all these facilities, this establishment will just implement, even if everyone is moving around, as long as there is this, observance of the minimum health protocols, it will prevent the spread. So it's the goal now. If we will be able to do it, probably 2 weeks or 3 weeks from now, cases will go down. Because the high prevalence, it's really there's a high prevalence now in cases. In fact, the back to work testing, it's yielding a high positivity rate. So it means there is really a high prevalence everywhere. So it's, for now, it's not advisable, especially the young ones, to to really be observant calls. Even here at the OC, at times you need to go around and check everyone. They seem like when they meet every day, no, so they became a little bit complacent, because it's something like that. But the key there is still the prevalence of the positive cases is still high.
One last thing, General. People are expecting of the vaccination program to be rolled out. Unsa may ato malantawan for that program, General Sir?
Well, actually, the OPAV, Office of the President Assistant of Central in the Visayas, the OH7, the business sector, and the IATF is having close coordination of to come up with a vaccination program. Now there is now a process on how to implement it. We're just waiting for the national task force on when is really the vaccine will be available. No? But as far as the programs, we're having this regular meeting to come up with a program not only for Cebu City, not only for Cebu Province, but whole region. In fact, we're considering the whole Visayas. As far as this program is concerned, we are on it. We're just waiting on when is really the vaccine be available.
Nagpadayon karon nga for mga kasibya sa living on COVID-19, no? I don't know, live baning kang Cebu Governor Gwendolyn Garcia to soyag paminaw karon ni gayuna.
Tuson ta dire. Mao na rason nga pangisgan ko yun ni. Ug barugan ko yun ni. Disahan nako ang Cebu. Dili mi ninyo makaya-kaya. Sila si RD Bernada and Dr. Jean made a very strong presentation in our behalf. There is no need for that. And I think it was Dr. Loreche was saying, that will be discrimination against Cebu. Kung dili ta pagawason, our critical utilization rate is very low. We're not overwhelmed. So the question should be, are we managing it? Our mayors already know the protocols. The people already know how it should be done. Let us take care of ourselves. Dili man pud tingali tantong irresponsable ang mga Subuanon. Maningkamot man pud na sila nga mabuhi. Ngano man, nabi yung mga pamilya, nago ni mga anak, maningkamot gini sila. But in the same vein, maningkamot gyud sad nga makakain taw kwarta. Kaya ron ipalit og bugas ipakaon sa pamilya. Pero nakasabot ko sa uban nga gikan sa laing mga probinsya kay nagkadilain man gud ang protocols. You know, I tried. Nag-tourism summit ba ako ato sa Region 7. Pero wa man mukuhan pang uban governor, so motong kita lang usa, no? So I decided daghan maka-interesado mga re. We are simplifying things for our tourists. Akabisita sila sa Cebu ug makakita og unsa kanindot, unsa kataho Cebu. Ang nakanindot sa Cebu province, lain-lain ang tourism activities. Gusto kag maligo lang kas dagat, nindot kay atong beaches. Gusto kag mag-diving, nindot sa kay. Gusto kag snorkeling, na sardine run. Gusto kag whale shark, asa pa makakita og di ang butanding. O gusto kag kitag treasure sharks to as Malapaskwa. Gusto ka mag-canyoneering, di asa Badyan ug Alegria. Gusto ka og mga waterfalls ug swimming, naata sa Badyan, naata sa Sambuan. Gusto ka og a certain island na nindot na Kapitan Silyo. Gusto kag bamboo forest na as Middle. Gusto kag longest coastline nga puti ang bus na San Remigio. So daghan kaayo. There's so much to discover and enjoy in Cebu province. Ang ako lang yun ani, basta kamo na gani panalipdan ko kamo ug ang sugbo. Cebu is moving on and moving forward. Daghang salamat.
Moto si Cebu Governor Gwendolyn Garcia, no, recorded message na to ang iyang pamahayag, no, ni Cebu Governor Gwendolyn Garcia, si recorded sa ni kang kuanda.
While we dealt with natural disasters,
kinsa di kang Mayor Edgar Labella, no, sa maong forum mga kasibya, no. Sige lang ato ning ipabati sa minaw na to kadiyota.
protecting our health and rebuilding economy. I believe it is both possible and necessary for businesses to reopen and still keep everyone safe. It requires all of us to be mindful and never let our guards down. Health experts have taught us how to safely go about daily activities even if the virus is still around. The new rise in cases is suspected to be linked to violations in our public safety protocols, specifically put in place against the virus. I call on businesses to help the city government in this fight by ensuring that measures are heeded at all times in their establishments. Mapasalamaton ako sa kalihukan sa Cebu COVID-19 Citizens Initiative nga nagtabang kanato pagpahibalo kabahin niining sakita unsa ang atong kinahanglanong buhaton. Kitang mga Subuanon na ila sa atong pagtibangay ilabi na kung naay giatubang nga problema. Kanunay ko kinigisulti sa makadaghan nga higayon. Kinahanglan ang atong pagtampayayong aron kita magmalampuson patok ning problemaha. Daghang salamat.
So si karon si Vice Mayor Michael Rama na.
Who are much concerned about our,
Ano mo live na ni, no?
which still a year ago we thought that this was going to be over, but the decision has to be made, and that is living on with COVID. My dear friends, as the convener head of the legislative body, bringing a bi-level composition, the executive, our mayor, more even support group that will bring it in a huge convener body. And we are now in several virtual, physical, T or focus group discussion and interaction. In fact, the latest was with a best practice by the city called Taguig. Timeline, so that for the information of all are very much encouraged to be involved in this oneness approach, for together we can definitely bring a rollout plan. And in fact, at one time we call it sprint in differentiation with marathon meeting. But this time we have to elevate even from a lightning process, because time is of the essence. And if we can even call it a blitzkrieg approach, so that we can have in due time a rollout storm plan. And we call it COVID vaccine storm rollout plan. And however, in the meantime, even if we can have the vaccine reach the household, still, as it is being intimated by experts, that it would not 100% completely bring anyone to be free from not being contracted with the virus thereafter. But the good thing, we will be able to develop certain level of herd immunity. Precisely whether you will allow yourself to be inoculated or vaccinated, what is really important, as I have been emphasizing, as we have created already a couple of months ago, headed by Dr. Peter Mancao, the Facebook, in fact, administration, on an organization called CPEM, Citizens Protocol Enforcement Movement, where if you will take part in the oath-taking, you will be called PEM, Protocol Enforcement Marshal. In that platform, in that dimension, when we are going from the household down to the workplace, even from the household to the malls, then from the household to churches, and from the household, anywhere you go, any fiesta, for that matter, any gathering, for as long as you will be reminded of Wuhan. And what is Wuhan? It's an acronym that will bring you to remember this virus coming from. But that W would mean wash your hand. Letter U, use your face mask. Letter X, have your temperature checked. Letter A, ubuhan, avoid crowded places. Letter N, never touch your face. Men, mouth, eyes, nose, and in public places, absolutely, please, wear your face mask. Observe physical distancing. Practice discipline. But I even have added, while eating, be it in pungko, in eateries, in restaurant, even at home, especially if you have some visitors in your living room or your dining room, please do not talk while eating. And last but not the least, in God we trust. Please put prayer in all of this. Mind you, from the city government, especially the voice of our mayor, Edgardo Colina Labella, with the city council, we will never stop making it as fast as we can and towards even entering a purchase agreement, and with the framework that we have placed in, we have the preliminary press con, whereby we already lay down the so-called activities that we went through already. And by tomorrow, we sing a platform, more of a multi-caucus, especially multi-sectoral in level, with the council, with the executive hoping to be in place, people in the vaccination board, and all the rest. This time, discussing and focusing no longer on the 11 so-called vaccine, but rather extracting, eliciting from all those who will be in the platform, so that we will all now bring everybody to know that we are really on a blitzkrieg. We are already in up toward a storm approach, and even including already having in mind our chief implementer, General Feliciano, to be the Colin Powell. I have thought of bringing him to be the Colin Powell of the desert storm, to bring all of this in one huge gargantuan body that will proceed a multi-sectoral and togetherness in oneness. So timely, very timely, that February 24 is the Charter Day. The theme of our Charter Day celebration is interwoven with faith, strengthened by unity, and we, the Cebuanos, celebrating our resiliency. So with God, Senior Santo Niño, let's look forward and let's have a timetable that we sing by the end of this month of February, we will already have something concrete. Then by March, furthermore, and by April, especially before we will launch our 500 years of Christianity activities, we will already put up the so-called framework ready, that if vaccine will arrive, then we can have all of this just to be placed, being functional, operational. This is Attorney Michael Lopez Rama, the Vice Mayor, Committee on Health, Chairman Information, Education, Communication of COVID-19 Task Force, and likewise now the convener head of the so-called, I call it CBSRP, which would mean COVID Vaccination Storm Rollout Plan. Thank you very much.
Si Vice Mayor Mike Rama, mga kasibya no, nga ni hatag sa iyang pamahayag murag for the day gihapon to ang maong pamahayag no sa mayor sa dakbayan sa Sugbo. Kinsay sunod aning maong forum mga kasibya. Uy, bagong naayos COVID. No? Nakabalik si Mayor Samsam Gulyas Jr. Mga kasibya. No? Ato pa binaming iyang pamahayag sa dakbayan sa Talisay.
So, ang ako lang is, first of all, I'm happy to be here, and maybe I could talk about my COVID experience and what we can do moving forward. First of all, first thing I did, tomorrow, February 24 is my 14 days isolation. So, I have no more symptoms. I asked the doctor, can I go home? So, ningon siya, why problema, Sam? Actually, my doctor told me, if I don't memorize it, give me a chance to read it lang. When I asked him, Doc, makauli na ko, Doc. Makakod pa ba ko sa akong pamilya, even 14 days into isolation? So my doctor told me that according to studies, 96% of COVID patients are no longer infectious after 10 days. 98% are no longer infectious after the 14th day, 99% on the 21st day, and 100% on the 28th day. With this in mind, nagsabot kami sa conductors na tomorrow, magpadayon ko sa ang normal life, go back to work, do normal activities again. Di lang sa kumuli sa balay and wait for 21 days kay namang ko'y bata sa balay, a 1-year-old baby at the house. So that's the agreement I had with my doctors and with my wife as well. But moving forward, unsa may atong buhaton with COVID? How do we live with COVID? This is my first take. First of all, I want the economy to come back. I think it has suffered enough, and I want the economy to come back. But I want to put two things into perspective. Kaya nakita man ako what people on my free time, I'm usually on social media. So nakita na ako sa mga tingog sa katawhan and what they want as far as what from the government is concerned, and unsa ilang gusto na mahitabo moving forward and with COVID still in our midst. First of all, people sometimes putting COVID down and not giving it much importance. As a COVID survivor or nag-agi COVID, I'd like to say that COVID is real. First of all, we have to accept that COVID is real. It is in our midst. Tinuod siya. Swerte lang ang ubang mga tao na walay symptoms. But if you are like other people, like me, like ako, na was very symptomatic and had to go to the hospital, di sad lalim ang amuang giagian. My breathing was okay, pero ang pain lang nako sa akong throat, murag na bildo sa sod, and ang pain lang nako sa coughing all the time na di ko makatug. But it got better over time, and I'd like to take this opportunity to thank the doctors and nurses out there na nakita gyud nako na basically ilang gibutang ilang mga lives on the line para makasave sila mga laing mga kinabuhi. So shout out yun sa tanang doctors, nurses, and everyone in the medical profession. So first, ang gusto lang na ko ipaabot sa mga tao is that COVID is real. We have to accept that. It is in our midst. But second, most niya, I'm one with Gov. Gwen. I'm one with the people who want the economy back on track. It would be very difficult to go through another lockdown again. So what do we do moving forward? This is what I want to do moving forward as far as the city of Talisay is concerned. Ang ako na lang gusto ko musturya sa mga tao that COVID is real and we have to find a balance between economy and health. How do we do that? I think it's very important that we know that COVID is here, that COVID is true. And second, ang importante yun, we have to realize that the government cannot be all places at once. Take for example the city of Talisay. Of course, we want to minimum health protocol, and the police is one help dako kay katabang. But come to think of it, the government needs the help of its people. The people will look to its government for help as well. One example of maintaining health protocols is the help of our police. there is a Talisay, one police for every 2,000 Talisaynons. So that makes maintaining health protocols very difficult. Ang ako na lang mo gini is that it should be magtinabangay ang gobyerno o ato ang mga citizens. Because parihata, trust me when I say parihata gusto. We want the economy on back on track and we don't want another lockdown. Gusto unta na ko i-implement sa Talisay moving forward. It's this. We should help each other. For the people who say that we don't want lockdowns, the government will do his part, our part, then we hopefully you can do your part as well. Wear mask. Importante kay na. Contact before I was COVID now, I've been in contact with many positive people. Pero wag ko na igo because nagmask ko. Lisod kayo na muingon ta na di taga nag-lockdown pero di ganito mo sulog og mask when we're out. Social distance. Tarungon og sulog ang mask. And that's what I mean that the government cannot be all places at once. But the government can info disseminate and the government can set an example on what we want to do moving forward. And mauni, we have to realize COVID is real. We know and we hear the voice of the people that they want the economy to get back on track. But we also need the help of the people to have their own little bubble. That they should wear their mask well, they should social distance, and hopefully with that, only then the government and its citizens are together. Only when the citizens is working with the government and the government are working with the citizens, only then only then that we will be successful in this fight against COVID when we have to live with COVID moving forward. Kaninyong tanan, salamat kayo. I'm so happy to be here to talk about my COVID experience and what I want to do moving forward. Kaninyong tanan, salamat. Maayong adlaw. I'll see you soon. Leading isolation tomorrow. Bye.
Mao to mga kasibya si Mayor Samsam Gulyas no sa dakbayan sa Talisay ni asoy siya nga kining kasinatian no man siya na positibo sa COVID-19 mga kasibya. Karon nato paminawon si Dr. Fiji Tambago no infectious disease specialist ni na siya mag-alagad sa UC Med mga kasibya at paminaw ning iyang pamilya.
COVID-19 infection. So the surge is usually brought about by a lot of our celebrations that has been going on. We have had crowding no in certain places because of Christmas. We had New Year, and then we had the advent of Valentine's Day. So with such events, we see people gathering, and letting their guard down. So in terms of COVID infection, kabaluta nga kanisiya makuha gyud ni nato based on contact, no? We are facing each other for longer than 5 minutes, and then we are letting our down, wala na nagamit properly, no, sa ato ang personal protective equipment such as the mask and the face shield, as well as social distance to speak. If we continue being more relaxed, no, in terms of practicing these health protocols, or what are the standard on preventing infections, mudaghan yun ni maayo ang mga kaso nato. So it is naara na nato, no, so that we already have a year, no, has
or putol no ang video atong balikan karon taton si Dr. Fiji Tambago, or na putol yun ang video sa mao nga forum mga kasibya no sa forum ni sa Cebu Citizens Initiative no. Muro po mga recorded mo to ang uban gawas lang atong kang isa pa tong uban na adikto mga kasibya no nga inutan ni ni padangat sa iyang mensahe mga kasibya. So ayan ako balik kadiyot ha. Kung di na kabalik ani moan yun na putol no ang maong forum mga kasibya ha. Akong so ayan ha. Okay. Okay ha. Wagit putol. Doon ay problema siguro sa connection sila da. Anyway, ato to suwayag balik karong taon-taon mga kasibya kung makabalik ta. Oy, good morning diha ni Felipe Borbon Minyosa, ni Ronnie Subing-Subing sa Lampangon, ni Japi Aranti Pinalosa, ni Ma'am Agnes Modesta sa Baldan, Danuka Diris Barili, perti ng kainit karong higayuna. Uy, panapan ng Diris Barili, Ma'am. Agnes, Tere Irida, Wilson Boris Herrera, si Ma'am Luz Pardillo, si Van Sanchez, may buntag babalik, si Joshua Baclayon, may buntag, si Ma'am Jennifer Magana diya sa Estados Unidos mga kasibya. No? Kunya kadiyot lang kay ha sa ato derong nasayra na to nga sa gipahigayon karon mga kasibya nga kalihukan no sa pagtimaan sa kining 35th no anniversary sa kining EDSA People Power Revolution. Basta kadiyuta ra kuan ra 15 minutos igo rang muhad sila og lukon sa mga buwak na sibya ang mga organizers ani no ang chair ani murag ang chair sa National Historical Commission si kini si Escalante no mga kasibya vice chair ani si Joey Concepcion kading usas mga ditudlo nga advisor ni Presidente Rodrigo Duterte mga kasibya. Gani si Concepcion na interview mo to ganina sa DZMM o sa teleradyo sa ABS-CBN no mitataw nga ang katawhan maghiusa na usab ang ngayan nga maghiusa na usab karong higayuna apan kining mao nga matawag nga para revolusyon mga kasibya para na ni sa batok COVID-19 mga kasibya no matod pa ni Concepcion ang revolusyon nga ngayang ipatugbaw karong higayuna mao ni ang batok sa pandemya no ang ngayan nga maghiusa ang katawhan aron nga mudaog batok sa giyera no sa giyera batok sa COVID-19 isubli ni Concepcion mga kasibya ang kamahinungdanon nga tanang mga Pinoy magpabakuna mga kasibya sa samay gayon yang gitataw nga ang batan-on karong higayuna ang ayan nga mo kuha o magsilbi nga mokuha nga og mosilbi nga inspirasyon mga kasibya sa nahitabo niadtong 1986 din midaog ang katawhan og gipalagpot mga kasibya sa diktador nga si Ferdinand Marcos atong higayuna mga kasibya. So munay kalihukan nga atong mapaabot karong lawat diri sa ato I don't know kung doon na may mga protesta o nagpahigayon pa diri mga kasibya og kining kalihukan no labot sa pagtimaan sa EDSA People Power Revolution karong adlaw mga kasibya. Murag pa gyud mabalik da ang maong forum kadiyot kaya pa ano ba kani ni balik karon kadiyot kaya na to ha ito yun pa ha Sa Almino ko. Okay. Anyway, kumplita din na ito makuha, no? Ngayon lang tagpasaylo, pero ato ning walang tadi summarize unya mga kasibya. Good morning diha ni Mama Sila San Juan, karong higayuna. Good morning ninyo, no? Tang sa iyang bahin mga kasibya, si Vice President Leni Robredo mga kasibya, may auhag sa mga Pinoy, no? Masama sa auhag ni Secretary Joy Concepcion na maghiusa gihapon, no? Batok sa COVID-19 pandemic o sa higayon maghiusa kining gihulagway niya nga hulga sa demokrasya sa Pilipinas nining pag-commemorate nato sa EDSA People Power Revolution mga kasibya. Matod pa ni Robredo nga ang hagit karong higayon na mao nga makit-an sa masag usa ka Pinoy, no? Nga ang iyang kalig-on, iyang kaisog karong higayon na o iyang kabug-os sa iyang pagtuo, no? Aron nga mopadayon sa trabaho nga angayan nga himuon karong higayuna o nga gikinahanglan usab nga ang pag-iusa karong higayuna mo'y angayan nga ipatugbaw. Matod pa niya nga usa sa mahinungdanong leksyon sa nitabo nga People Power Revolution mao ning pag-iusa, no? Og ang angayan nga buhaton nga lakang mao nga mabuntok, no? Og matuman og angkon og katumanan unsa man ang mga hagit taliwa nining nasinati nga pandemya mga kasibya. Sa samayon si Robredo mitataw nga ang katawhan naa paghihapon sa iyang hulagway nga process of forging the nation we dreamed of and fought for on EDSA mga kasibya. So munay pamahayag, no, ni Vice President Leni Robredo karong adlaw mga kasibya. Ang uban sa mga opisyal sa gobyerno karong adlaw, no, mi padayag sad sa ilang mga statement karong adlaw mga kasibya sa sa ulog nato. I don't know sa saktong term sa ulog, commemorate, handom gunang commemorate, no? Sa ulog siguro kay kuan man or pagtimaan ana siguro, no? Pagtimaan sa makasaysayanon nga pagtabo niya to 1986 mga kasibya, no? Sa kining nahitabo sa February 25, 1986 mga kasibya, no? Si Senador Kiko Pangilinan, by the way, sa iyang bahin sa miingon nga ang mga batan-on mo'y angayan nga mo handom o angayan nga mahibaw unsay angayan o unsay nahitabo niadtong 1986 EDSA People Power Revolution mga kasibya. Kini ato gayuna sa diyang ulbo to sa kini si Pangilinan, murag kuha ni siya student leader ni siya sa University of the Philippines sa atong higayuna, no? So matod pa ni Senador Pangilinan nga ang katawhan o ang mga batan-on, no, angayan nga mahigmata unsa ang nahitabo ug unsa ang angayan nga makatunan nga aksyon sa nahitabo nga People Power Revolution mga kasibya. Gani gisulti pang Pangilinan nga bisan gani ang kining grupo sa K-pop, kining Korean pop nga BTS, matod pa ni apil is manawagan sa mga batan-on mga kasibya nga mobarog ug mohimog lakang, mohimog aksyon pinaagi sa pagpatugbaw sa unsay angayan nga lakang nga himuon mga kasibya, no? Dili angayan nga pakasagdan unsa ang nahitabo sa imong tagtagsa ka mga lugar, angayan ka nga mohimo og lakang mga kasibya. Lisod ako quick balik da. Anyway, minaw ta ani kung ato ni mapabati pag-usab, no? Ako lang siguro ni dissect na lang no sa musunod nga mga takna mga Sibya si kung refresh diri mo ragwa yun balik no ang maong gipahigayon nga forum anugon sige lang. Good morning, pwede ang inyong orasyo katong bag-o ng paggawas nga orasyo sa simbahan o amo pa nang kuan rod sir kuan na mo ang bag-o nga doon na may bag-o to nga orasyo impirata sa Catholic Church no batok sa COVID-19. Salamat kay Sir Joe Pipito Senior ha sa pagpahinumdum namo sir. Morning diha kati umpad ug uban atong mga naminaw na nanaw karon sa atong June Perez, Kapares at your service sa mga kasibyan. Anyway, pasalamat sa inyong subay sa atong tulumanon na karong buntaga mga kasibya. Salamat kay sa inyong wa gihapoy puas nga pag sunod sa atong tulumanon mga kasibya diri sa SIbyaTV o sa atong tulumanon sa June Perez, Kapares at your service. Sa sa itong mga kubanan sa SIbyaTV, sa ano sab ni Anjisan nga dinyo kauban karong buntag muna ni overland sa tagamay sa atong tulumanon karong buntaga. Salamat kayo sa inyong pagpatalingog hangtod ugma sa laing edisyon sa atong mga tulumanon diri sa SIbyaTV. Bye.